Hi, Dr. Stoker here in Los Angeles, getting ready for our next case. 50-year-old nice patient of ours who I've operated on before. She lost a large amount of weight, well over 100 pounds. She also has type 1 diabetes, so we're spacing out the procedures that we do in different stages for patient safety and to make it reasonably easy for her to recover. Today we're going to do the breast and lateral chest. I'm super excited about this because we previously had done the abdomen, which was looking good, but the breasts are still hanging down over it, spilling out on the sides. So go ahead and, well, actually, I'm not going to have you lean over to protect your, to hide your identity. But what I will do is show you what these babies are going to look like later, which is good. In the cleavage area here, we're going to make create an internal bra, so she's going to have a lot of nice fullness up there. And very importantly, we're also going to get rid of all this lateral chest tissue. Go ahead and move to the side a little bit. I mean, this really isn't breast out here, it's lateral chest, but this would look like a breast on the side once this is high, tight, and perky. And you know how this stuff can spill out of a bra or create rolls in the back. Well, we're going to get rid of that at the same time too. Bring it right back here as far as I can go without flipping her over on the table. You might say, well, he's going to take out an extra inch over here on the side. No, that's going to be about 8-9 inches of vertical height of skin just out of the side here. We call this a bra line backlift when we go a little bit further. This is going to be a lateral chest skin excision as part of this case. We're also going to take some of this soft tissue and incorporate that up on the inside here to create a nicer, fuller, prettier, ideally shaped breast. You guys cannot see her face now, but she's got a big smile on her face. She's ready, been waiting for this for a long time, and we're ready to go.